Good afternoon, everyone. I'm Melissa Madelon with the Consumer Technology Association. Welcome to It's Not Just Fun and Games, How XR and Robotics Can Transform Healthcare, part of CTA's Technology and Standards Spring Forum. We're very glad you could join us today. I'm really excited to welcome our three panelists who will be sharing their insights about XR and robotics and its impact on healthcare. As many of us know, given the current pandemic, healthcare is not only facing unprecedented demand, but we're also seeing an increase in technology adoption unlike we've ever seen before. The use of these emerging technologies provides for many an entirely different healthcare experience than what they've been used to, and we're seeing this technology improve health outcomes. A few logistics before we get started on the panel presentation today. We're going to start by sharing the speakers' remarks and discussion, which we've recorded earlier. Although the panel has been pre-recorded, all three speakers are live with us today, and they'll be answering your questions after the panel discussion. To submit a question to our speakers, click on the icon with the speech bubble in the toolbar at the bottom of your screen. Feel free to submit your questions at any time. And with that, let us get started. Before I turn things over to our panelists, I did want to highlight some of the work that CTA is executing in both the XR and robotics space. Within our member groups, the XR Working Group, which is open to any CTA members to participate, as part of their scope, we've been tracking consumer perceptions and awareness of XR technologies for 4 years. This fall, we're really excited that we'll be sponsoring the 5th annual Tracker Study, which provides year-over-year insights around consumer understanding and familiarity with these technologies, terminology, access points, ownership levels, use cases, and more. The XR Working Group also collaborates closely and supports the work of our AR/VR Standards Committee. This group has published 3 standards related to definitions and characteristics, as well as recommendations and best practices for the use of accessories with XR. In addition to our work in XR, we've also been supporting the robotics industry through market research with our consumer sentiment study published last year and with the robotics advisory group within the standards department. This group is comprised of key stakeholders in the consumer robotics industry, and they've completed work on definitions and characteristics as well as security. If you or anyone on your team is interested in learning more about our work with XR and robotics, please feel free to reach out to me. I'm going to be sure to include my contact information in the chat box so that you can contact me directly. And with that, I'd love to turn things over to our presenters. Our first panelist is Brian Eberman, CEO of Pillow Health. Brian, can you tell us a little bit about yourself, your role, the company, and how you're using these technologies today?
Thanks, Melissa. It's really great to be joining you here from Health at Home, right? Since we are live from our houses, this is very appropriate for Pillow, which is a device and a system and a platform designed to help people manage their health at home. Just wanted to give you a quick overview of the company and myself. So this company was actually founded in 2015 as a mission-driven company based on a personal experience that our founder, Emma Mussini, went through with his own family. I came into the company about 1.5 years ago. I have a deep background in robotics and AI, and I've run a number of companies in the greater Boston area, including my last company, which was Jibo, the social robot. So really here, what we're doing is applying a lot of the ideas about social interaction, voice-driven interfaces, to building a home health companion with medication management as the first component of that solution. We are currently in market. We sell directly to Stanley Black & Decker, and they sell a product called Priya by Stanley Black & Decker to consumers. They have a big presence at last CES. And we're really excited to be working with them, and we are now expanding into a provider market. I could show you a pillow, but here's a quick picture of the device. It is an integrated solution with voice-first interface where you can talk to it. It's got a camera on it to do Face ID, so it knows who it's talking to about your personal health. In the back of it, it manages your medications. You put in your meds and it dispenses them to the right person. And we provide targeted health content related to your particular disease state. All right, we're now integrating with a number of provider networks and with a number of components, so you can get things like a COVID-19 solution where there would be a pulse ox meter and a temperature meter tied into Pillow And particular information, we now ship information that's a whole COVID-19 quiz. So you can, based on the CDC recommendations, figure out whether you may or may not need additional testing. So we don't just provide the device, we provide a companion app so that we can link the caregivers. Home health care is really about a network of care. The user, who is the one who has a chronic illness, needs to be linked to their family generally, who may be monitoring their care, and to their professional care providers. So the app is there so you can make video calls, check in on your loved one, send them check-ins, call them, see when they've missed their medications, and see what's going on. So if you're managing an older adult who may be having some issues, it provides a great companion relationship and a way to ease your mind. And then we provide an enterprise portal for providers, which we integrate with remote health companies, so they can have professional nurses monitoring what's happening with people and do reimbursable services remotely to keep people out of the hospital, which is a very, very important thing right now, right? To keep people with chronic conditions out of the hospital and at home. So that's Pillow. Happy to answer any specific questions about our solution.
Thank you, Brian. Exciting to hear about what you guys are doing, and particularly how quickly you've responded to the current COVID-19 crisis and deploying your technologies today. Look forward to discussing that a little bit more in the question section. Just a quick reminder for everybody, as Brian said, if you do have questions, just please do put those in the box at the bottom. Now I'd love to turn things over to Scott Edgar. Scott is co-founder and CTO of Eris MD. Scott, tell us about yourself, and we look forward to hearing about how your company is deploying these technologies.
Thanks, Melissa. As Melissa said, I'm Scott Edgar. I'm the Chief Technology Officer for Eris MD. Eris MD, we visualize large data sets, which is a difficult thing to do. And doing so quickly is even more difficult. Medical imaging data sets generally take an image or a slice every 3 to 4 millimeters, which means that anything smaller than that size can be missed. We retain and display the entire data set, which allows doctors to look at the complete image, a task that is generally too time-consuming when looking at slices rather than looking in 3 dimensions. A large majority of the AR/VR industry use engines like Unreal or Unity, and these engines are really not designed for working with large data sets like those found in MRI and CT scans. As a result, we've developed our own proprietary rendering engine, which can handle these data sets and render them in AR or VR in real time. This allows us to visualize data directly without having to rely on an intermediary step like creating 3D models. Now, as you may well know, low and varying frame rates in VR can lead to motion sickness. The 3D models used by many other companies to display large data sets rely either on an algorithmic or an artistic impression of the data in order to reduce the number of polygons and render at a consistent speed. That means that anything missed by the algorithm or the 3D modeler will be missed from the data viewed by the doctor. I'd rather somebody looked at my X-ray than looking at a painting of it, wouldn't you? Now, we're able to render the original data without modeling at high consistent frame rates for large data sets. So we don't rely on any kind of interpretation of that data in order to display it, which means we retain the fidelity and accuracy of the original images. Our vision, of course, goes beyond just displaying the data. We use artificial intelligence systems to interpret the imaging, which highlights regions of interest for doctors and assists in diagnosis. It acts as a second set of eyes for doctors to ensure a high accuracy in reading imaging and ensuring that nothing gets missed. Now, as an example, we've had sets where we've discovered secondary brain tumors that were not identified by the original reading doctor. And by drawing attention to those areas of interest found by our system, we can not only help doctors to make a diagnosis, but also make use of the doctor's feedback in order to improve our detection systems for future scans. We go beyond diagnostics, though. Once an issue has been identified, we can take this to the patient room, allowing doctors to show patients in AR or VR what's wrong with them, and even where the problem exists in their body. In the past, doctors have relied on drawing diagrams on a whiteboard or a piece of paper, diagrams that are often meaningless or confusing for patients. So patients are often shocked by bad news, and they're unable to focus on what they're being told by the doctor. This creates even more confusion and anxiety. So by displaying the patient's real imaging, a doctor can share with their friends, their family, the exact nature and location of their pathology. So this means that, for example, you could go to your doctor and receive a diagnosis, and they could give you a USB stick you can take home. And you could then see in VR or AR, or even just on your computer screen, exactly what's wrong with you and be able to describe it to your family and explain it without having the confusion of trying to remember what the doctor said. This imaging can also be used for medical procedures. We're as different on the inside as we are on the outside. Your heart and my heart are in different places. And there's no way by looking your outside for a doctor to know exactly where your heart or lungs are. By overlaying personalized image data onto a patient, a surgeon can see the makeup of the patient. We use augmented reality to show them exactly what your body looks like on the inside, giving them X-ray vision and showing them where to cut, and more importantly, where not to cut. This leads to more efficient, less costly, and safer procedures. So a doctor can therefore use our patented software to make a diagnosis, share that diagnosis with the patient, and perform a treatment using an overlay. It saves time, we save money, and most importantly, we can save patients' lives. Thanks, Melissa. That's all for me.
Thank you, Scott. Very exciting to hear about how you guys are using XR technologies, and really look forward to discussing that a little bit more in our discussion portion after this. For our final panelist this afternoon, I'd like to welcome Yusuf Saleh, who's the founder and CEO of Ava Robotics. Yusuf, I look forward to hearing your insights, and tell us a little bit more about yourself and your company.
Thank you, Melissa and Scott and Brian. Pleasure being on the same panel here with you guys. I'll start with a little bit about my background. My experience has been in the enterprise space. I spent a couple of decades in the video conferencing, telepresence space, and the last decade or so has been in the robotic space. The vision and the idea of developing Ava was based on the vision of robots will be part of everyday life in the workplace, doing many tasks, being autonomous or semi-autonomous, coexisting alongside people. And we believe Ava Robotics is leading the way in ushering this new, exciting new era, allowing people to be in remote places in the natural way. We are spin-off of iRobot, so we have a deep technical heritage from iRobot, and we've been independent for the past 3 years. We led, in terms of our first product that we brought to market, is the Ava telepresence robot, and it is today in production. And we're excited to share some of the core capability of the product and how it's making changes in the current COVID-19 crisis. As I mentioned, we are in production. These are some of the examples of our current customers. And I inserted, because today some of the hospitals don't allow us to use their names, I just inserted a photo, and I'm happy to share about the applications in both the hospitals and elder care that spurred on us based on COVID-19. Just to give you a little bit of an idea of what is the Ava telepresence robot. It's the concept of ability to teleport, the ability to have people be in a remote place in a simple, easy way. So from a user perspective, they could use their personal device, a phone, an iPad, their desktop, browser, and the only thing is needed is a robot at the facility where they need to be. And with a click of a button, you could be literally at that remote place, have a spontaneous interaction, site visitations, being able to behave as if you're really in that specific location. I'll show you a couple of, few of the applications that we focused on, allowing, as we all know, organizations are dispersed, and being able to collaborate naturally, being able to walk up to a person that usually you would if you were in the same office, Today, some of the applications we're seeing in the hospital, in ER room, in elder care visitations, some of the corporate applications we're seeing goes well beyond what I'm referencing right here. I'll just flip through some of the images showing the interaction. As you see, this is a team collaborating. Now you could collaborate anywhere. It doesn't have to be in a conference room or in a set fixed location. You could be anywhere around that facility. In the elder care application, in the recent COVID-19 crisis, most of the nursing home, assisted living visitations came to a halt. One of the things that we're able to deploy immediately, quickly, because nobody had to change anything, is being able to allow family members, healthcare providers to literally be there and provide services or provide emotional needs that these elder community needed. Similarly, around healthcare and hospitals, we've had hospitals that deploy these robots for immediately into the emergency room environments where doctors and nurses could minimize the number of times they interact directly and minimize the exposure to the virus or bringing it in and out of that facility. I have a quick video. I'm not sure if this is the right time to play it. I'm going to play the video, just give you an idea of how the robot works. Thank you, Melissa. Back to you, and looking forward to answering questions.
Yes, thank you, Yusuf and Brian and Scott, for all of your presentations. They were very informative and I think very timely, given everything that's going on today. I do have a couple of questions for you guys, just as I was thinking about our discussion today and through some of the information that all of you shared. My first question is actually for everybody. Thinking about coronavirus and how this has changed many different things in our lives, from the way that we interact with other people, the way that we shop, obviously even where we work, all of us are remote right now. How has this impacted your businesses? And specifically, have you seen an acceleration in interest and a need for the technologies that your companies provide?
I'm happy to jump in. Absolutely, we've seen an increase in traction for ourselves as our technology can actually be used our technology can take scans and compare them. So we can look at things like a drug trial, and we could say, okay, if I give a patient this drug to see if it has an effect, and we take a scan before they're administered the drug, we can then scan them again a couple of hours later and determine quickly if there's actually results from that drug. So say there's fluid in the lungs, or the ACE2 receptors are all affected by COVID. We can determine very quickly whether that has changed and whether that change is positive or negative. So yeah, absolutely, we've seen some definite traction from this.
Yeah, I could share some of our experiences here. Obviously, there's an impact with the coronavirus. We're all working from home. But in terms of the direct impact to our business and how our technology could be helpful, in addition, so I break it into three phases. We have now, during the height of the COVID-19, and then there is what's happening as people plan for the transition and beyond. In terms of now, we have, as I mentioned earlier, we have hospitals, elder care facilities where literally saving lives and also addressing some of the shortages of PPE. In the hospitals, for example, they put the robots in the emergency room, and the objective of that, or the way they're using it, is minimizing the number of times the doctors and nurses have to actually walk in and out of a COVID-19 patient. First is, safety for themselves, but also on how every time they walk in and out of that patient room, they have to put on protective gear, and not just takes time, it's shortage of these equipments, that minimizing the number of times they have to literally use this equipment and replace it. In the elder care, there are lots of stories, you could find them online now, where all the facilities stop the visitations. Some of these folks are late stages in their lives, and the need to meet their family members is so emotional. And we're able to literally immediately, after our robots arrives within 2 hours, family are making visitations, moved it into doctors and healthcare providers to also provide services. These are things that are happening now. We're also seeing organizations looking at how are they going to connect the virtual and the physical spaces, and how robots would play a role in that.
So I think the virus and the need for sheltering in place and the resulting social isolation has really highlighted the use case that we were already working on. So, our device was designed to help people manage their chronic conditions and provide that social connection between the person who's got the chronic condition and their caregivers, both their loved ones and their doctors. And we're now seeing a lot of interest, huge use on our video capability to connect with that person who now needs to remain isolated because they may have existing precondition that can lead to higher risk on COVID. We're seeing medical professionals basically saying, look, we don't really want those people here, so we can keep them out of the hospital longer, right? So at least staff and people, frankly, don't want to go in, right? Because they're a little concerned they might get the disease at the hospital. In independent living, where people are paying professionals or caregivers to come in and refill medications, maybe once a week, that's now an issue because that person is now a possible contamination vector. And we all know that the older independent living and dependent living, are the places that are having the highest fatality rates. So having a device like Pillow in everyone's home so they can just check in by video and help them through the refilling by themselves is a really interesting use case that we're also seeing independent living ask us for.
Yeah, no, I appreciate all of that, what all of your organizations are doing to help during this crisis. And I think it just shows how technology is so critical and important to helping everybody kind of manage through, whether it's their own kind of personal well-being or future planning for the workforce. I think it's pretty amazing to hear what you all are doing. Brian, I'd love to kind of build upon what you were speaking to. Obviously, Pillow has a very social kind of aspect to what you provide. How does that experience help your user engagement?
All right. We're a voice first device, right? And what we want to do is engage people on their health in natural conversations, and we want to be there around health. So when we look at our user data, we see that users will be asking a couple of questions every single day that are not health related, but are typically sort of standard social things that this population wants to know, like weather and latest news. And each one of those interactions gives us a moment where we can ask about their health or ask them about a physiological measurement that we might need in order to provide information back to their doctor. Then the fact that we do medication gives us additional interactions. And then the third source of interactions is really the social connection of the whole network, right? So the family caregiver might send a check-in, hey, don't forget to go for your walk, right? For someone doing arthritis, or don't forget to drink water, which is actually one of the highest check-ins because people on some of these meds start to forget the very basic activities of daily living, and their health can decline from those effects.
Yeah. And Scott, it was pretty amazing to hear about the ways that your that XR's kind of being deployed and the opportunities and use cases. Thinking about that, how do you see XR playing a role in the future of autonomy with respect to medicine?
Well, I think that XR in medicine has a great future, actually. I mean, the amount of data that we can display in place using augmented reality, for example, being able to see inside a patient's body, but taking that further, you have devices out there that are capable of performing surgeries, impairing those with XR and various VR AR technologies, such as being able to have a surgeon look essentially through the eyes of a robot while a procedure is being performed, and being able to have infinitely more steady hands at a much smaller scale. I think that robotics and XR can be combined to make much safer and much faster and much more efficient surgeries that would be beneficial for everybody.
Yeah, it's exciting to hear about what's happening in that space, and I think people would agree there's a lot of opportunity there. And Yusuf, so you were speaking about telepresence and some of the obvious benefits. We all know, given the new physical distancing guidelines and caution that now consumers, providers, organizations, everyone wants to maintain safe distances. Have you seen the willingness among users and consumers to adopt or use this technology change, kind of given this new normal? I know that before there was definitely, we saw one of the barriers was that consumers were a little unsure of kind of substituting a robot in place of another person. But have you seen that willingness shift given everything that's going on now?
Yeah, thanks for asking that question. That's a very important question when you're dealing with robotics and how the human interaction with that. There are two different things that are at play here. One is our technology, our solution is designed with that in mind. So it's not just a screen, and the whole body language, the height, the eye contact, and the fact that it's a person, it's you on the screen, eases that concerns and the adoption and the acceptance. But what we're seeing directly, whenever you bring these kind of technologies into the healthcare system, the adoption is usually slow for many different reasons as well. We were incredibly surprised of how quickly they adopted and wanted the robots not just to be in the hospitals, for example, but right in the heart of emergency room, dealing directly with patients. And we have direct feedback from both doctors and patients and elder care, nursing homes and assisted living, where they absolutely love it because they realize how realistic it is, and the void or the problem they're solving was way superseded any concerns or weakness in terms of interacting with a robot, because it's really a person on the other end.
Yeah, I know even just for myself, I haven't seen my family like many others in quite a while. So I'd like to have a robot here to see my mom and dad and sister and everybody. Yeah. So I have one final question for everybody before we turn to the audience. And I know none of us have a crystal ball to see into the future, although I think we wish we did. But really just what do you see as the biggest opportunity for these types of emerging technologies as it relates to healthcare in the next 12 to kind of 18 months? And I'll start with Brian.
Yeah, I mean, I think we see, the virus, I think, has really driven the healthcare industry in some interesting ways and gotten people a lot more used to doing things with telehealth and remote care. So I think we're going to see a major transformation of primary care over the next 18 months, and potentially some changes in the payment structure related to that as some of the larger companies see opportunity. So what we think is going to happen is that as other companies that, some of them are retailers, for example, reach deeply into primary care, they're going to want to find ways to deliver that primary care extremely effectively into the home. So we're working to provide that solution for them, and then tie that into the hospitals and the integrated delivery networks when it gets to more critical care and more specialized care on the post-acute situation. Right, so I think we're going to see some really interesting handoffs built on an interesting technology fabric that we're now getting in place and people are getting used to. We're sitting here on this Zoom call, figuring out how to communicate and deliver a really interesting conference. And I think the doctors are now figuring out how to do that for care. And I think everybody's going to get very used to it over the next 12 to 18 months. And that's going to lead to some really interesting changes.
Awesome. Yeah, the creativity and innovation right now happening all over is really something to see and really exciting. Scott, what do you see as kind of the biggest opportunity?
I think the biggest opportunity is that people are definitely getting used to being more at home. And I think that technologies like XR allow people to be outside their home and experience things in ways that they can't generally do that right now. There's a lot of people that really want to get outside. They'd really like to get on an airplane and go somewhere and visit. And the ability to do that using XR technologies, I think, is something that will be adopted more quickly than it would have been had people not been put in a situation where they need to stay home. So I think that's really going to drive that market. At the same time, I think that it will be difficult for manufacturers to keep up with the demand in order to supply the units. And I think that the marketing of those units, because you don't have the word of mouth and the ability for, if you go over to a family member's house and they have a VR unit, you can't really do that to go try it out. So it's a kind of leap of faith purchase for people to jump into something like that without having necessarily experienced it. So that's what I see as the adoption and challenge over the next while.
Mm-hmm. Yeah. And Yusuf, what do you see as the biggest opportunity?
Yeah, on the same theme, the realization of how much could be done using the technology, remote, working from home, effectiveness of that, being able to provide services in a most cost-effective way, but on demand. And the acceptance of the quality of these delivery of these services, we're going to see an opportunity to automate, to accelerate the digitization. There's no reason why we can't enable robots to do some of the triaging or some of the, wherever there's risks that robots could be delivering that or engaging, and the acceptance from the healthcare, not just doctors and service providers, but also from the patients, the communities, that will extend that beyond just, we talked about, from my end, talked about telepresence, but imagine the opportunities of disinfecting, being able to have robots that go around and disinfect the space, delivery of, so minimizing that interaction, preparing for next pandemic or next crisis and be ready for it is a huge opportunity for the healthcare industry and for us.
Yeah, I think whatever learnings we can take to hopefully prepare and make sure that we're able to use these technologies for any future crisis is going to be really important. Well, thank you, all three of you, again, for your presentations, for this discussion. I want to make sure that we leave some time for the live audience Q&A. So I'll turn things over now to see what questions we have from the audience.
And it looks like we have a few questions coming in already, which is great. A quick reminder, if you do have any questions that you'd like to ask, just use the box at the bottom of your screen, and we will be sure to include those. To get us started, Brian, it looks like I have a question specifically for you, looking for clarifying some information about your technology and what you guys provide. So I'm just confirming your technology is using facial recognition and pupil movement for self-diagnostics of vital signs.
So this is Brian. So we use facial recognition to recognize the person in order to do medication dispensing to the right person. We integrate through Bluetooth third-party devices to provide a more complete solution.
Okay. Hopefully that helps answer the question. If you do have one additional information, feel free to put your question in the box. And then Yusuf, a question that came in that I think you can answer, and also I'll come to you, Brian, as well, because I think one of the use cases will be interesting to get your thoughts. But Yusuf, understanding the success and the potential for telepresence in healthcare, What are your thoughts on other use cases? And I think the individual here was looking specifically at interest in retail as well as aging in place. So Yusuf would love your thoughts, and then Brian, I'll come to you for the aging in place piece too.
Yes, sure. Thanks, Melissa. Actually, our concept of leveraging the intelligent mobile robots was really more of a horizontal application. Applies everywhere. It's the concept of, with the telepresence robot, is the concept of being able to teleport people to where you need them. And the specific example was asked about retail. We actually do have customers in the retail space. You could imagine, if we talk in general, or even as a post COVID-19 world, being able to, as simple as we've had some customers now asking us for greeters. Robots could become greeters, where it has a knowledge and a capability that could potentially be better than what we've had in place. The main thing to think of in the telepresence robot is the ability to literally allow people to be where they want to be and bring experts to where they need to be in factories, in offices, in retail, in healthcare. It's really horizontal, not vertical application.
Mm-hmm.
Do you want me to pick that up? This is Brian.
Yeah, that would be great.
So I think I can actually answer both a little bit, both from the Pillow Health perspective in my prior company, which was Jibo, the social robot. So in the aging in place, we do think Pillow Health is very, very interesting in aging in place, especially around the whole COVID situation, where, the social isolation is a really important factor. And so that's why we have video calling, right? That telepresence piece that was just mentioned is really important just for connectivity between people on a video line. Also being able to measure, things like temperature and do a survey on COVID, helps people understand whether the people that are aging in their independent living facility are still healthy. On the retail side, making their retail chains down to the bare minimum of staff, people walk out when they can't get help. And so that churn is a real issue for retailers. And the ability to have a robot that would greet somebody, tell them, answer some simple questions, and then tell them how long it'll be before someone can help them was of value to a number of potential customers.
Awesome. Thank you both. And Scott, a question for you. So given the vast amount of data that's being collected, and obviously in a healthcare environment, a lot of that being sensitive, using XR, are there additional privacy or security protections that should be in place using this technology in that setting?
Yeah, I think that the traditional model of ensuring that a physician has access to that data before they're actually able to access it is important. And when we talk about the idea of people being able to bring home imaging, I think that kind of puts the control of that privacy into the hands of the individual. If you've been given a set of your images to view in VR, for example, then obviously it's easy for you to take responsibility and say, okay, I'm willing to share these images with these people, and I'm not willing to share it with people that I don't know. So I think that the barriers there are actually kind of minimal, provided that it's an individual kind of XR environment. If you were to extend it to something where you have groups of physicians, then yes, I think there could be additional concerns there where you need to make sure that all of the physicians involved have consent. But in general, single use, no, I don't think there's any additional challenges that really come with that, with the addition of XR.
All right, and we had another question for you, so I'm just going to follow right up to that. So what are your thoughts on using haptics or wearables to facilitate surgery simulations in XR?
Yeah, absolutely. I think that the use of haptics in surgery through XR is extremely important, actually. being able to have the feedback and that sense of touch, like you're actually involved in doing something, rather than in a VR experience. If you're looking at images of somebody's brain and performing a surgery, if you were to have a robot surgeon linked to your hands and you decided to plunge your hands into the middle of that brain, that's not going to result in good things. Whereas if you had some kind of haptic or some kind of restrictive device that would prevent you from doing that, I think it would be important to make sure, especially since somebody can't see the world around them during VR. I mean, it would be tragic if somebody were to slip or something like that and cause an accident in an environment like that. So I do see a significant value in the use of haptics and other kinds of feedback with XR, in particular in fields like surgery.
Mm-hmm. And then our next question is actually for any of you who want to answer, but an audience member asked today, is there any work or research being done on brain-computer interfaces? And do you have any thoughts on how BCIs are used in healthcare?
There is work being done on it. I don't know. I'm not an expert in it. Obviously, there are people trying to do control of motion, right? I think that's probably the most useful one. And there are some people trying to get it to actually speak from brain connectivity.
And then we had another question for Brian and Yusuf. So I'll start with you, Brian, and then Yusuf, I can get your thoughts. But what measures do you take to ensure that the robots operate safely in their environment? So understanding issues like around mobility or battery charging, et cetera. What does your organization do to make sure that these new technologies are being operated safely in the home?
So I'll answer first. I mean, ours is pretty straightforward. And we really, our device doesn't move. So the core issues we worry about are privacy, and then from a safety perspective, the battery. So the battery is fairly straightforward design problem. From a privacy issue, we take great care to separate the information that we're gathering, make sure everybody knows what information is coming in, and separating that from the personally identified information. So we can never tie the two together.
Mm-hmm. And then Yusuf, do you have thoughts on that? Because I know obviously your robots are being used in a number of different environments, but what are you guys doing to ensure that they're able to operate safely?
Yes, so our robots were designed from concept to coexist with people in workplace, in large spaces, dynamic, and in addition to the intelligence of sensors and multi-sensors, we have LiDAR-based sensors, visual sensors, and the robot has the intelligence of moving very safely, utilizing all these multi-sensors as integrated part of the product. From a battery or a charging perspective, the robots could run pretty much all day without having to be charged back. But when they are on the charger, it's low voltage charging connectors. So it's a pretty safe and been proven in both enterprise hospitals and elder care facilities. And from a security perspective, our product's not designed to be in the home. They're designed to be in larger spaces, commercial spaces. From a security perspective, we partnered with Cisco, and our product uses enterprise-grade, secure, encrypted end-to-end from the video audio perspective. And our customers have the ability to have the network traffic be controlled to within their environment as they desire.
Great. And then Scott, I think this would be a good one for you to answer from the audience. Medical robots with XR capabilities. do we see them becoming more commonplace in appliances in the home as a way to give vaccinations, address minor first aid, doing diagnostics? So do you see the use case of XR expanding beyond kind of in the medical, hospital, doctor's office to an in-home environment? And are there any obstacles to consider in a future like that?
Yeah, absolutely. I can see applications very, very broadly there. Having something like a small medical pod within the home would be ideal for things like small cuts or even a cut requiring stitches, that sort of stuff, or for diagnostics. And there's actually all kinds of benefits that reach beyond just having that in the home. I mean, if you have somebody who is sick with an illness, you look at things like the current COVID situation, somebody who's sick with an illness being diagnosed at home by a device, I think would be much safer than having somebody go to a public environment and waiting to see a doctor, all of that process. It would also take burdens off the healthcare system, which I think in turn would reduce the costs for everybody across the board. As far as challenges, I think that the biggest challenge that we see in robotics with medicine is that a robot, of course, doesn't have that human touch, and people are comforted by that and feel more comfortable with that. And I think that we have a little bit of almost evolution to go in terms of becoming more comfortable with robotic systems as kind of a norm within society. So hopefully that answers the question.
No, it does. It does. And I love the idea of a health pod in the home. But you actually hit on a point that addresses our next question, which was, how do we add that human element to make consumers, patients, and other users comfortable in using these different types of technologies in healthcare? You obviously noted that as a barrier, but how do we add that human element to what we're doing? Scott, I'll start with you, and then I can go to Brian and Yusuf as well to see if you guys have any thoughts.
Yeah, I mean, I think one of the big things that happens there is that we try and create robotic systems that have a comfortable form factor. So you want a system that looks somewhat human, that sounds somewhat human, where the voicing sounds natural and kind of emulates a human as best as possible. At the same time, I think that there is kind of I mean, 30 years ago, nobody carried a cell phone around, and now you're kind of an outlier if you don't have a cell phone. And I think it's the same kind of thing where we become acclimatized to a technology over time, and at some point it becomes somewhat indispensable. And I think that's the same kind of curve we'll see with robotics and systems like medicine, where it'll be potentially slow early adoption, but as people become familiar and see the efficacy of the systems, they will become more and more comfortable, and it will become more acceptable until it just becomes normal.
Mm-hmm. Yeah. Brian, any thoughts on that?
Yeah, I mean, I think it's a really interesting area that a lot of companies are pursuing more generally out than just the healthcare space. It's sort of the next generation of interactive AI. I think you've seen it called emotional AI, cognitive AI, social AI. The design matters. That's why we have Pillow the way we have it designed. But I think what matters even more is understanding the person you're interacting with and customizing your responses in a way that makes sense for that user. So if people feel a degree of attachment, if the device seems to be responding to them instead of just scheduling them. And that's an area that we're very focused on. So I think that's what distinguishes a companion from a utility.
Yeah. Yep. And I definitely want to touch on the technology pieces of the specific technology pieces that help drive the adoption, like AI. But before we get to that, Yusuf, I want to make sure you can, since, obviously having a telepresence robot, you want to make sure there is a human element. So very curious to hear your thoughts on this as well.
Sure. Obviously, design does matter. In our case, we did not want the robot to be a humanoid type of robot, and it is a human. In our case, it is a person that is embodied in the robot and interacting, and we believed bringing that application first to market will ease that comfort and adoption and interacting with robots, because in this case, it is if it's in healthcare, if it's a service provider or a family member or a colleague, that's who is on the robot. It is humanized by that. What we're providing is the ability to allow them to move around easily, to have that freedom of movement and independence, empowering their presence. So in the telepresence application, it is a human that is on the robot.
Mm-hmm. Yeah. And then, so lumping all of that, the human element in, and then touching on the piece that Brian actually spoke to, which was, using some of these emerging technologies like AI, you can include facial recognition. I think also thinking about 5G and the opportunity that presents. What are some of those technology enablers that are going to help us drive broader adoption of these technologies across many different use cases? I'll ask that of all three of you. I'll start with you, Brian, and then I'll go to Scott and Yusuf.
I think one of the most interesting things, I think is reinforcement learning, the things that have been happening in reinforcement learning. Right now they're being applied to games, but if you put it in a narrow enough space, I think you can start understanding people's behaviors and what they like and don't like, and adapt an experience, basically make the experience adaptive to the way the person wants to experience it. And I think that'll be a really interesting thing that'll roll out, on all of our devices, not just healthcare devices, but also our phones and our cars.
And Scott, any thoughts that you have?
I think that, as we move forward and systems become more intelligent, we're going to see greater comfort and greater adoption. And I think that really over time, we get better and better with the ability to understand the needs of customers and how to perform things better. And I think that one of the things that we'll see is that if we open up surgeries to things like AI systems, for example, we'll see that those systems could develop ways of performing surgeries that we don't currently know, that we don't have, and that could be an improvement over what we do now.
Definitely. And Yusuf, I'll ask you the same, your thoughts on this.
Yeah, all of that applies. And I think in one additional area of intelligence is really the advancement in the vision intelligence, and how, especially when you have a mobile device, having the vision intelligence and advancement in vision intelligence, integrating that all of the different capabilities into providing a complete solution is going to be powerful.
Yes, completely agree. And I know we're really excited about all of these different emerging technologies and benefits and all the positive use cases for them. So we've run through the questions and we're running near the end of our time here today. So I just want to thank Brian and Scott and Yusuf for taking the time to share their information with all of us. This has been really exciting and informative. So I appreciate all of you, and to all of our attendees. If you'd like to continue this discussion, our robotics advisory group, which focuses on consumer robotics, is meeting right after this at 3 o'clock. There should be information in a box on the right-hand side of your screen. So hopefully you can join us then, but thank you for joining us as part of our Technology and Standards Forum. And thank you again to all of our presenters today.